I'm Chief Medical Officer of NeuroVive, and with me here today is also our Head of Business Development, Dr. Mark Farmery. And I will give you an introduction to parts of our very exciting portfolio with a focus on the clinical projects. So NeuroVive, we're a company focused on mitochondrial medicine, and we have two projects at clinical development stage where mitochondria are key to the disease development. And beyond that, we have a broad and innovative portfolio in preclinical stage. So we are a publicly traded company, so we're listed at Nasdaq Stockholm. So mitochondria, what is that? Well, mitochondria are most well known for being the powerhouses of the cells. So those are the small parts of the cell that efficiently converts food and oxygen to an energy source that the cell can need. But the role of mitochondria extends well beyond energy production. They're also important for life and death decisions in the cell and the overall health status of the cell. And mitochondria make up about 10% of your body weight, and they are especially important in organs requiring a lot of energy, such as the brain. Non-functioning mitochondria can lead to cell death, cell dysfunction, and then translate into organ failure. And our mission at NeuroVive is to develop compounds which enhance and protect mitochondrial function in order to address serious unmet medical need in a lot of serious conditions we currently lack any effective treatment. So the first of those areas I will introduce you to today is genetic mitochondrial diseases. And this is a very good fit for our scientific expertise, but it also is a niche area, orphan drug area. And this area has a lot of incentives, so it's appropriate for a small company like ours. And we have a high ambition to drive these projects all the way to the market. So as an introduction to this disease area and to our strategies to treat these diseases, we have produced this short movie.
Mitochondrial disorders are a varied group of different diseases, which all stem from a defect in the mitochondria. Mitochondria is where your body's energy is created. Nutrients such as fat and sugar are mixed together with oxygen, which produces energy. And energy is needed in all activities from thinking, seeing, talking, or walking. Disorders can affect all areas in the body, causing symptoms like fatigue, walking problems, heart failure, blindness, and mental dysfunction. Treatment options today are very limited, which is why we are developing 3 treatment strategies. In the first, energy production is restored along with protecting the cell from harmful byproducts. And the production of new, functional mitochondria gets a boost. In the second, we bypass the dysfunctional part of the mitochondria, introducing a fuel substitute to kickstart the energy-creating process. In the third, muscle function is protected by stabilizing the mitochondria from the effects of the disease. NeuroVive, leaders in mitochondrial medicine.
So genetic mitochondrial diseases, as an umbrella term, they're a group of rare syndromes, and they can also be called, usually they're short forms of a longer name, so MELAS, KSS, Kearns-Sayre syndrome, PEO. And those are probably names that you never heard of unless you have a relative or friend affected. On our webpage, NeuroVive.com, we have another movie where a patient with MELAS gives his perspective on the disease. And that also highlights that many organs can be involved and how the disease can progress during life. So these disorders are caused by genetic mutations that affects mitochondrial function. And typically they continuously progress and the body's organ deteriorate. And they can range from extremely severe conditions with lifespan of only a few years to only affecting a single organ, such as blindness in a condition called Leber's optical neuropathy. So these are, as I mentioned, orphan indications, so they are rare diseases. So there are incentive programs that facilitate development. So this area is characterized by less costly development, shorter time to market, and a decreased risk of failure. And most importantly, there's a very high unmet medical need. So for most of these conditions, there's virtually no compound approved. So our first strategy, as mentioned in the movie, KL1333, the mechanism of action there is to correct NADH and NAD+ status in the cell, and thereby increase energy production and the generation of new mitochondria. Here we are in the middle of a phase 1 program. So a first phase 1 study has been completed with single dosing to healthy volunteers. Now we're about to start a multiple dosing trial, both in healthy volunteers and in patients. If everything goes well, we expect to be on the market by the mid-2020s. Children are usually severely affected by this group of disorders, and Leigh syndrome is a typical presentation of genetic mitochondrial disease in childhood. So often these children are perfectly healthy up until a couple of years of age. Then they have what people with normal mitochondria would consider a simple infection, a common cold. But that is such a high energy demand on these poor children, so they can get a very severe disease, severe neurological symptoms, epilepsy, regression in the psychomotor development, and gradually, usually more organs are affected. And in most cases, they die after a few years due to organ failure. And typically they are worsened during periods of energy crisis. So, for example, by simple infections. Our solution to this problem is a compound NV354. We specifically designed this compound for the most common molecular defect in Leigh syndrome. So NV354 is an alternative energy source, so it bypasses this molecular dysfunction. Here we are in the formal preclinical development stage, and we have a strong data package and have actually received quite a lot of scientific interest from the community for this strategy. And we have also received a non-dilutive grant from Vinnova, 5 million SEK, a few months ago, to support the development to take us into clinical studies. And we expect to be in clinical studies in about 2 years' time. Our other major disease area where mitochondrial mechanism of action is very important for the disease pathology is traumatic brain injury. That was actually the program that once founded our company. So traumatic brain injury is also an area with a huge unmet medical need. There is no compound available to limit the consequences of head traumas. It is also characterized by a very high burden of disease and societal cost. So each year there is about 50 million head traumas in the world. And they can range from mild injuries, sport-related injuries, to very severe injuries. And the severe injuries bears a lot of individual consequences, a lot of neurological disabilities, and a high cost. So the societal cost was calculated last year by a group of investigators to be $400 billion if you calculate both the direct and indirect costs. So that's an astronomical sum. But what gives us hope and an opportunity in this area is that most of the brain injury doesn't happen right away. There is a continuous degeneration of brain cells after the initial head trauma, and we can limit that process. And our solution to this and what we hope to be the first effective treatment to limit the neurological disabilities following head trauma is Neurostat. So Neurostat stabilizes mitochondrial function. It increases the brain cell's resistance to these biochemical events that happen after the trauma. And here we have also orphan drug designation. I didn't mention that, but we also have that for KL1333. So we benefit from these incentive programs and have enhanced market exclusivity. Here we are in phase 2. So we completed a first patient trial, actually here in Copenhagen. That was an open label study, and we showed that our product is safe to give, that it enters the brain. And we also did an exploratory biomarker study, and that actually gave us the first signal of clinical efficacy. And supporting that package, we also have a very strong experimental study package, and the latest study we did showed a 35% reduction in brain injury when we give the drug in this study, just as we do in the patients. Here we work closely with a network of experts, also to seek non-dilutive funding to support this program. And we have designed a very innovative trial strategy for a phase 2 efficacy trial. So we hope to be able to start that during 2019. So this is also a very high value market. So this is a summary of our prioritized part of our portfolio. We have several other preclinical projects. But here are the 3 programs I mentioned today and NV556. We have a very high ambition at NeuroVive. We want to drive these 3 projects in blue, in traumatic brain injury, in genetic mitochondrial disease, all the way to the market. So as we progress these compounds, the risk of failure decreases and the value of each program increases dramatically. But so does the cost of clinical development of compounds. And for that reason, we are seeking new money to progress all these 3 programs. And the majority of that funding we hope to raise will go to the clinical programs, especially KL1333. Then we have other sources of financing. I mentioned non-dilutive funding, and we have been very successful with the NV354 there. And we have a similar strategy to share the risk also for our TBI program. We have an out-licensing portfolio, so a lot of our expertise is relevant also for non-orphan disease indications. And those of you that have followed us know that we are actually looking for a good partner for our lead NASH program, NV556. And last year we had a successful out-licensing, which came to surprise to I think a lot of our followers. We out-licensed a project at very early stage, and that increased the chance that we will be successful in the genetic mitochondrial disease space. So an American company found our strategies very interesting, so we did a carve-out to treat a specific disorder by local treatment. So in summary, we are addressing very serious conditions, so we have a strong development portfolio and hope to be able to deliver life-changing solutions. We have a high-performing team to deliver that portfolio, and we have near-term value-adding triggers. So please visit our webpage, neurovive.com, to get further information. Thank you.